Well, staying in Lagos, the Federal Ministry of Health and Social Development has inaugurated a 13-man National Health Research Committee to help upgrade treatment in the health sector through accurate research findings. Senior correspondent Jacqueline Ogon reports.
Medical experts always emphasize that national planning must involve adequate research funding. For example, research helps to point nations to how agents of diseases like bacteria and viruses are mutating to curb health catastrophes. At a time when the globe is witnessing the emergence of new diseases and tropical Africa is battling to stay safe, research development has become a top need. To ensure Nigeria treads on safe lines, the Federal Ministry of Health has inaugurated a 13-man committee made up of local and international experts to see that the nation's health sector does not operate under medical ignorance. The chairperson of the National Health Research Committee is an American-trained researcher of 4 decades of extensive search for knowledge. She says proper funding and international collaborations are pivotal to innovative research.
The committee will be able to collaborate with researchers, scientists, healthcare professionals, and policymakers to bring forward bold ideas, ensure that our efforts are coordinated and impactful.
Our plan for this National Research Committee is sustainability, and the President plan on everything he wants to do to transform the healthcare system is just not for now, but for sustainability.
To reduce Nigeria's dependence on foreign medical interventions, the newly inaugurated committee will have to see that the nation has standardized laboratories, a dependable cold chain vaccine storage system especially to ensure existing and emerging diseases are effectively tackled. Disease surveillance, early warnings, implementation science for evidence-based findings are responsibilities that the National Committee on Health Research will be handling, and Nigerians are watching to see how they change the landscape of the nation's health sector. Jacqueline Ogo, TVC News, Lagos.
Now, for more on matters arising in the health sector, I'm joined by the Minister of State for Health, Dr. Tunji Alausa. He joins me on the news at 10. Thanks for joining us.
Thank you so much for having me.
Right, so one of the biggest challenges we've had over time in the health sector is the issue of funding. But it would seem as though there is an increase in the budgetary allocation. Last year, it was 1.17 trillion. And this year it is 1.3 trillion. In the light of that, should Nigerians expect more deliverables from the health ministry? And what will be your focus?
Yeah, thank you. Yes, Nigeria should expect more deliverables from the health ministry. We have a president, President Bola Ahmed Tinubu, GCFR, who has put a lot of emphasis, commitment in funding our healthcare sector. He made the campaign promises when he was campaigning, and now he's fulfilling those promises tonight. One of those promises to Nigeria. One of those promises is ensuring each and every citizen of Nigeria gets meaningful and comprehensive health care. Now, there are a lot of things we started doing as a ministry. Myself and Honorable Mr. Pate working for the president, working for Nigeria. We came up with 4 broad pillars on how we're going to reform, strengthen, and improve our healthcare delivery system in Nigeria. The first pillar is improving governance in the healthcare sector. Governors holding ourselves accountable as physicians, as providers, as healthcare providers, holding our facility accountable, the way we care for our patient, and then even the way we talk to our patient, the way we talk to one another. That's a huge part. That's the first pillar that we've laid out to improve the healthcare delivery system in our country. The second part is improving our population health outcomes by strengthening our healthcare delivery system, improving infrastructure, improving equipment in our healthcare sector. And the third pillar is unlocking the value chain of our healthcare delivery, healthcare sector. where we can begin to engage, bring industries, pharmaceutical industry, medical device industry, that will come to our country, produce enough that produce hundreds of thousands of jobs, well-paying jobs, sustainable jobs to our citizens. And then, of course, the fourth pillar is seeing healthcare beyond physical security, but as social security and part of our national security. Now, part of these enablers of these four pillars, we're going to digitalize the healthcare sector, and then research that you just mentioned, research and innovation is a huge part of what we're doing. We're rejigging it, redeveloping our research ecosystem, where we're going to now drive our healthcare system with evidence-based policy. Now, you can't get enough money, but we've been able to set some money aside in this 2024 budget for our health research agenda. You saw today, earlier on today, I inaugurated the high power committee. That's a national health research committee led by a renowned Nigerian who's very accomplished, Professor Lopate.
And Honorable Minister, my apologies that I have to come in, and I know you're enumerating all that will be done and all that has been done. Well, I mean, the health sector, almost every part of the health sector is plagued by one challenge or the other. But the biggest challenge for Nigerians today is the issue of qualified doctors. I can't even remember the last time I was in hospital, because the last time I was there, or last few times I was there, I couldn't find a qualified medical personnel to speak with. And that's the biggest issue. There have been several efforts on the table, but especially by the National Assembly, to curb this brain drain. It doesn't seem to be working. What is the health ministry doing about this?
Now, we now have, and we're going ground up, durable, sustainable, permanent solutions to solve our healthcare, human resource for healthcare problem, healthcare workforce. Just, if you be kind enough to give me 1 minute to elaborate on this. We have two pathways that we're approaching here. Now, the immediate thing we're doing is massively increase the production of our healthcare workforce. Now, by this academic session, we've doubled enrollment in all our medical specialties in our universities and other training institutions in the country. We've doubled enrollment into medicine, pharmacy, dentistry, medical laboratory sciences, nursing. More so with nursing, what we've done before we came in as a government, we're only enrolling just about 28,000 nurses into our nursing school. We've quickly put in programs in place. Today, we're enrolling 66,000 nurses. And what's going to happen before the end of the year, we will be enrolling over 120,000 nurses. You would have heard about an initiative the federal government is doing with the state, with Lagos state government as a pilot that we're going to roll out in all our 36 states of the federation, including FCT. Lagos, by the end of this year, will be enrolling at least 2,500 doctors into their medical school. Now, about 3,500 nurses, several hundred pharmacy students into the pharmacy school. Lagos is setting up a Lagos University of Health Sciences, a freestanding university in partnership with the federal government.
So the basic is to ensure that at the education level, there's more enrollment of students who are studying health sciences. We'll see how that plays out. That's a long shot, because it doesn't look like that's going to yield results until the next is yet, but we'll continue I'm afraid we do have to leave it there. I'm sure we'll continue this conversation with you, definitely continue this conversation with you, just to get clarification more. We've been speaking with the Minister of State for Health, Dr. Tunji Alausa. Thank you so much for talking to us.
Thank you so much for having me.